Hello, good day. My name is Olushola. I'll be your nurse today and I'll be conducting an interview concerning your health history. Is this a good time for you?
Yes.
Okay. Can I can you please tell me your name
John Carlos,
and your date of birth?
0301 1978.
And how would you like me to call you?
Carlos.
Okay. Can you just check the contact information I have here, the phone number, are they all correct?
Yes.
Okay, so this health history is going to help us to know more concerning your. This interview is going to help us to know more concerning your health history so that we can know how to care for you.
Okay.
So tell me, what brought you in today?
Wellness check.
Okay, good. So I'm going to be asking you some questions and I would like you to answer me to the best of your ability, okay?
Okay.
And let me know whenever you feel uncomfortable if you don't want to answer some questions. That's good, okay?
Okay.
Do you know, do you have any non allergies? Maybe food or medications?
Yes.
What are you allergic to?
Dust and shrimp.
Dust and shrimp. So, what reactions do you have whenever you take them?
I just have runny nose.
Do you take any medications for this?
No.
Have you ever seen a doctor concerning this?
It hasn't get to that level. So I just stay away from the food and stay away from any area that is dusty. I don't react when I see the food, but it's just when I eat it.
Okay, so I will encourage you to make sure you always look out for um, food labels and know so that you can see whatever it is if they have the shrimp on it.
Okay.
So concerning the reaction, the running nose you have, like it lasts for like how many days whenever you have the running nose?
Maybe for like 6 hours. Not so too much like that, it's just little. Then I'll know maybe I'm exposed to dust. When that sign comes, that shows I've been in the area I am, there's dust there.
Okay.
And I don't put my glass down when I'm driving.
Does it affect you from breathing?
No.
Do you have any lungs or any issue with your heart?
No.
Okay. Any difficult breathing, any chest pain or discomfort?
No.
Okay. Do you use glasses?
No.
Any hearing aid?
No.
Okay. Do you have any dentures on you?
No.
Okay. So, do you have any history of the lung or cough?
No.
Any shortness of breath? Any wheezing or history of asthma?
No.
Okay. So, do you have any issue with your abdomen? Any your gastrointestinal?
No.
When was the last time you had a bowel movement?
This afternoon.
So, how often do you have bowel movement in a week?
In a day, it's one or twice.
Okay, you have it. Is that the baseline for you?
Yes.
Okay, good. Any change in your bowel habit?
No.
Any nausea or vomiting that you have?
No.
Okay. Do you have any pain, any joint pain, arthritis, or do you have any history of that?
No.
Okay. Have you ever had any bone fracture or injury?
No.
Okay. Any history of stroke or diseases or kind of like headache, dizziness, vertigo?
No.
Okay. Do you have any numbness or any history of numbness and tingling in your hands or in your feet?
No.
Okay. So do you also have any history of, if you have any history of diabetes or thyroid disease?
No.
Okay. Any excessive taste or hunger?
No.
Any changes in your weight recently?
No.
Do you have any issue with your skin or any history of skin diseases?
No, no,
like dryness, itching?
no. I don't have all that. The only thing that it's on my skin is just moles around my neck region. I
Okay.
have a couple of
When did this start?
like 7 years ago.
And did you see a doctor?
Yes.
Did you get any medication to
No.
treat your mole?
No.
So okay. So is there like any itching or any change in size of the mole?
No, not that I know. When I put my finger there just to run to check. No.
And the size still remains the same?
Absolutely correct.
No itching?
No itching.
Okay. Any changes in the mole?
No.
Any skin sensitivity?
No.
Okay. So I'm gonna delve a little bit into your social life. So are you married?
No.
Are you sexually active?
No.
Okay. So what do you do for a living?
I'm a teacher.
And do you love your job?
Yes.
So how do you manage your stress?
When I get back, I sleep, go out, have fun with my friends, then come back home.
Okay. Are you a smoker?
No.
Have you ever smoked cigarette or any before?
No.
Have you ever taken any recreational drug?
No.
Okay. Do you take alcohol?
No.
Have you ever taken alcohol sometimes?
No.
Okay. So about your diet, how is your diet like? How is there a kind of like restriction or a special diet that you are into?
There is no restriction. The only special diet I do is eat African food, but there is no restriction.
Okay, that's good to know. So what about your physical activity? Do you exercise often?
Maybe once or twice in a week.
Okay. So do you take are you on any medication like prescribed medication or supplements or over the counter medication? Is there anyone you took recently that you like
No.
us to know? Okay. So now I'm going to be asking you a few questions also concerning your family history. So is there any history of heart disease, maybe from your father's side or from your mother's side that you know of?
No.
Any diabetes or cancer?
No.
No hereditary immediate hereditary family member like?
No, not the one. I don't know about that. The answer should be no.
Okay. So when was the last time you have your dental care?
That should be 1 or 2 years ago.
Okay. So
Let's say 2 years ago.
I will encourage you to have it check every year.
Okay.
Okay. So what about your eye check?
I think I did that in January.
Okay, that's good to know. So is there any other concern that you let us to know today?
I don't have any concern.
Okay. So I'm gonna be taking your vital signs, okay?
That's
Before I'll send you into the doctor.
okay.
Can you please raise your close your appetite? Okay.
So what's the number on my temperature?
98.1.
Is that good?
Yeah.
So what's the number on my blood pressure?
122/76.
Okay. Is that good?
So I'd like to go through all what we just did down. So if there is any omission, you let me know, okay?
Okay.
So you told me your name and your date of birth. Okay, the record we have here concerning your data, is that correct?
Yes.
Okay. So you told me you're only allergic to dust and shrimps,
That's correct.
and you have runny nose whenever you have, and that lasts for just few hours.
Yes.
And you never take any medication.
Yes.
So you said there is no issue of any heart disease or chest pain, discomfort, or any palpitation.
Yes.
No respiratory issue, no asthma, no wheezing.
All right.
Also, you had your bowel movement at least every day.
Yes.
Okay. No nausea or vomiting.
That's correct.
Okay. No history of arthritis or joint pain, muscle pain, or bone fracture.
That's correct.
No headache or neurological deficiencies.
That's correct.
Okay. No diabetes or thyroid. No fatigue. And you denied any excessive test or hunger.
Yes.
So you told me about the moles on your neck, which you had like 5 to 6 years ago around
It
your
started
neck.
around 5 to 6 years ago. That's correct.
And you said the moles that they did not change, they're just like the same,
Yes.
and only on your neck area.
Yes.
And you never took any medication.
That's correct.
No itches or sensitivity in your skin.
That's correct.
No changes in the mole.
That's correct.
Okay. So you also told me concerning your occupation that you are a teacher and you love what you do.
Yes.
That the way you relieve yourself or stress is to hang around your friends and you come back home and you're okay.
Yes.
Okay. No smoking and no alcohol consumption.
That's correct.
And you've never taken any recreational drugs.
That's correct.
Okay. No weight loss recently that you know of.
That's correct.
And no history of diabetes, cancer, or any hereditary disease from your lineage.
That's correct.
Okay. So you also told me about your dental care that which you had 2 years ago, and
I'm planning to. You asked me that I should do it every year, so I'm planning to make
also
an appointment
for your eyes check which you did recently.
Yes.
And no new concern at this time.
That's correct.
Okay, I will send in the results to the provider now.
Okay.
Thank you.
Thank you.